Hello, madam.
Yeah, it was interesting project today, what you did. Hi, Pinky.
There are another three centers. We are calling them tomorrow.
Very nice.
Yeah.
Hi, Kapil. Hi, Shalini. Yeah, you're muted.
Hi, how are you?
I'm good. How are you?
I'm going on, surviving. That's all I can say.
I know.
Yeah, Sushma, I think we are on YouTube also. Okay.
Yeah, I saw that. Yeah. Shall we start?
Yes, we can start.
We have about 18 people.
Yes.
People will be joining.
Yeah.
And then there is a recording if they want to watch. We
Yeah.
should not waste Shalini's time.
No. I
Very
think let's
precious.
start. I think people have started logging on to YouTube also.
Yeah,
So,
yeah.
okay.
Oh, okay.
Thanks,
Good,
everyone.
good, good, good.
So, good evening, everyone. Thanks for joining us tonight for this session on plasma donation with Dr. Shalini. Dr. Shalini, thanks so much for accepting our invitation and coming and giving a talk to the audience. So just a quick introduction to Dr. Shalini. She is chairperson of ICAT Foundation, co-founder and director of ICAT Air Ambulance, perhaps the uh, first service which is available in the country. And we have been hearing about a lot of things doctor and her colleagues have been doing. It's incredible. Like in fact, the other day, Mrs. Abbas Saxena and me, we were talking to her, and perhaps both of us were thinking we had a long day at whatever 12, 14 hours. We came to know doctor had put in 22 hours in surgery and flying around. So that's it. And we figured out that's a typical day. So I mean, hats off to her and all the doctors and the frontline Medicare workers, through this channel today. She's been campaign head of Mission Cope with HCG and Karnataka government. She'll be talking about that. That includes the doctor, if I'm correct, the plasma therapy also, and and a whole host of things which she's been doing out there, the Society of Emergency Medicine, etc. She's been a practicing doctor. She shuttles between Bangalore and London, but since COVID has come in, she's been down here in India, and she's been contributing her might to the society out here. Thanks, doctor. Thanks so much. Welcome again to the session out here.
Thank you, Mr. Lee. Thank you, Ms. Abba. Thank you so much for inviting me. And it's a great pleasure. And moreover, I think it's a kind of mutual respect for what we have between yourself, all the brigade group, and also your Rotary, in bringing me on board to doing something back or giving something back to the society or the community in terms of when it needs the most. As doctors, we are trying to fight it out from the hospital inside or whatever we are doing. And I think I always say, the first line is always doctors and police, and the second line is the second line are the grocery shops, pharmacy, and things like that. The third front, which has emerged during this disaster, which has never ever been a strong front at all, like so far, it has emerged, I would say, becoming one of the biggest backbones of this COVID war. So this is like the third front is you people, like the way you come up and how you're giving hand to for the medical community to fight it out, or it is for the society to strengthen their belief, their boost their morale, and giving whatever you can. And it is a very significant thing. I think the third front is equally important as the first and the second, because the first and the second would have collapsed miserably if it was not for the third front. And I'm also being the not only the just the front line and also the part of this the third front. I would say in terms of being part of the COVID India campaign. I'll just do a small presentation about what COVID India campaign is, and then how we have been working on this plasma or Mission Cope, because our entire focus is on Mission Cope today, or COVID Plasma Endure, which was launched last year during the first wave with the Karnataka government and HCG, and Dr. Vishal Rao from the HCG is heading the clinical, and I'm heading the Mission Cope. So if you don't mind, I'll just start this a small presentation which I would like to show how we have been kind of giving hand in terms of as a third front, not as a doctor. And my air ambulance work is totally different, and this is much more overwhelming this time than it has ever been the last time. Because there are more and more complicated patients this time than the last time. The younger generation are getting involved. To a certain extent, the older generation have been lucky enough to have these vaccines, and certain degree they have been kind of protected. At the same time, the people who are dying today are the ones who are severely. I think in every one of you must have known. Last year, it was like every one of you would have known somebody who was affected by COVID. This time, every one of you, I'm 100% sure, knows somebody who has lost a life in your first circle or the second circle. So it just shows the gravity of the situation and the disastrous nature of this virus. Let me just take you through my presentation now. So this is COVID India campaign, which was launched last year March, and it is mainly it is under the aegis of ICAT Foundation, which I'm the chairperson. And COVID India campaign is a body which kind of has a platform of all the volunteers who are mainly IITians and people from IIM. And there are, of course, CFOs, people from BITS Pilani. We also have medical students. We have intensive care doctors. So, like, we have different task force here. Like, one is a medical task force, one is a Medi Warriors, that is a medical students, and of course the lead volunteers. So this year, along when we ran quite a few initiatives very successfully, we have more than 50 volunteers is from last year, but now we have nearly around 250 volunteers. Mrs. Swadeep is a co-founder of the COVID India campaign. We ran 4 initiatives successfully last time, and we enabled more than 4 crore worth of N95s and PPEs. We became the kind of a bridging gap between government supply until they gave a supply, and until we supplying coming as a bridge in between when there was kind of a little gap. And of course the government was doing it best. I think everybody was trying to put their best foot forward, and the third front also kind of gave a huge hand in this. So we did COVIA, which was a COVID Virtual Innovation Accelerator. We used to bring in all the new innovation, because at least now there are certain things which are already established, like PPE and N95. Nobody knew what a PPE, what a N95 was last wave. So we brought in a lot of innovations. We connected them to the state war room, state governments, and then the investors scaled up the production, and it was all done pro bono. Of course, we have put in more than 2 lakh hours of pro bono into this, a very quality, like a very high quality from the kind of leaders from all fields. Saviors, as I said, distributed this N95 PPE throughout India. Splitters, we developed our own in-house splitters for the ventilators, because we knew there's going to be huge shortage of ventilators. And of course, like, we also we wrote a cookbook with a Confederation of Indian Industries. Along with them, we sat and said, like, this is how because most of the ventilators were imported from France or Germany so far. So but in India, nobody used to make a ventilator. That's where we kind of wrote a cookbook with what is a basic ventilator should have in a disaster like this, or a pandemic like this, along with one of the top Indian intensivists giving their input, and then we wrote that cookbook. So of course, these are all the healthcare workers who have given up their life. This is our donation. I just kind of tried to go straight into the COVID India campaign. We got kind of a very good donations from the ACA, and a lot of other people donated for us. We raised our own kind of a fund as well, and that's how we would manage to kind of do 4 crore worth of donation across India. And of course, it is our ventilator with the CII. Then this is Mission Cope. So Mission Cope was the plasma bank was inaugurated on July 22nd for the first time in Karnataka, and we had only like around 2 donors at that time. We kind of got it up to nearly 1,200 donors, and we opened multiple plasma banks, because blood bank can't be plasma bank. To become a plasma bank, they need to have a special license, and plasmapheresis machine should be there, which separates red blood cells from the plasma. And because the red blood cells are given back to the donor, this was opened in the Ramaya hospital. And then we also kind of what Mission Cope did was, because there was nothing like plasma donation, nobody had heard about it. At least this time there is a bit of a knowledge, there's a bit of awareness. So there was nothing last time. So we onboarding the donors, onboarding the ICUs, COVID units, setting up protocols, guidelines, motivating donors, setting up plasma bank partnerships like Rotary. A lot of organization came and gave us a hand in this, and of course the campaign. So went into these cohorts of positive group like Garuda Force, then into the Karnataka State Reserve Police, where we used to have quite a good chunk of donors, and that's where our kind of donors sourcing the donors from. So Karnataka Reserve Police took a lead in this. ADGP Alok Kumar led the entire campaign from his side for the police force. He did cyclathon wearing our t-shirts. They went around Bangalore every weekend, and they kind of used to sign up for donors like in hundreds. We donated a plasma machine as well, like plasmapheresis machine, to Mysore Care Hospital. And Mysore being one of the second highest hit districts, didn't have a plasma bank, and that one we donate thanks to Atkins, who contributed the entire amount, and of course some amount from our side, and we donated the machine there. And this was inauguration of the plasma bank. And of course we had multiple partnerships with Rotary and COVID-19 plasma donor group, and some Gupta sisters from Hyderabad, Samar Bharat, and Pan India Plasma team. This is the lower side. Then we conducted these camps for the police, like where we used to test the positive ones, find the antibody levels. And Ramaya Hospital, Dr. Alva, the hematologist who led the entire thing in testing the kind of almost like 200 people we tested, and we picked up the donors from there. This was the first time ever in world this kind of test for a plasma donation campus organized outside the hospital environment. And of course we had a great turnout with the support of Mr. Alok Kumar. And that function was attended by Mr. Nagendra Prasad as well, your Rotary governor, and I think that's him sitting there. So like Rotary gave us a huge hand as well last time, and this time like kind of we have more people coming and supporting, like you people. I just kind of show a small video, promotional one, which we did. Let Hope plays, because I'm not very good techno. Okay, fine, good.
COVID patients who've themselves experienced this realize how tough this is, not just for them, but for their friends, their family members. Everyone goes through a massive challenge. Now, with this plasma therapy, you can actually contribute in helping someone getting better, recover faster. I would request everyone who's had COVID and recovered, gone back home, to think of donating their blood for plasma therapy.
Namaste. Plasma therapy is a very important and vital weapon in the war against COVID today. Globally, it has been recognized more than a decade ago by the WHO that convalescent plasma therapy during the Ebola outbreak was a useful tool. And thereafter, its utilization in corona infections has also been explored very diligently. Now, today we know from data across the world, from scientific publications, that plasma therapy is a very effective tool, because the antibodies that are present in the blood of people, of patients who have recovered, can become medicinal for sick patients who are not able to produce these antibodies in their blood. And that is where it is very and help patients who have
Yeah, just a second, everyone. We'll just try to get the video on.
It looks like this is more of a Zoom issue. Sometimes, it doesn't get streamed well.
Right. Okay, fine. Can I just?
Yeah, we can move on.
Okay, right. Okay. So I will share that link, and then of course you all can watch.
COVID patients who've
What about
themselves experienced this realize how tough this is. Not just for them,
Right.
but for their friends, their family members. Everyone goes through COVID a massive challenge. Themselves experience now this. With this realize how tough plasma therapy, not just for them, but for their friends, actually contribute in helping someone getting better, recover faster. A massive challenge. I would request now with this everyone who's had therapy, COVID, and recovered, you can actually contribute in helping someone getting better, recover faster. I would request
plasma therapy.
everyone
Sorry,
who's
no,
had
not able to stop.
COVID
Give me a minute.
and recovered, gone back home.
The war
Think
against
of
COVID.
Shalini, I
donating
believe
their blood
the
for plasma therapy.
thousands of videos are running at the same time, and maybe you can close it, and you might be sharing just your presentation and not the screen, so that's where it might be happening.
Take me from the stop sharing.
Also been explored. The antibodies that are present in very diligent blood of now today we know patients who have recovered across the world can become medicinal for sick patients who are not able to produce these antibodies in their blood. And antibodies that are very important for us to encourage and help patients who have recovered to become a good Samaritan, medicinal for sick patients who are not
Playing at two places, I think.
very important for us to help recovered patients. Become a good Samaritan to help government of India, help states, other patients. So this is my
I think if you share the PPT, we will all, will share it with everyone. And maybe you can just tell us the message and we can move on.
Sorry about that. I'm a doctor. Get me out of here. Technology.
No problem. Okay, excused.
Sorry.
So, yeah, you can
I think you're
continue with the slideshow. Doctor, you can continue with the slide. Doctor, you can continue with the slideshow.
Can you hear me?
Yes, we can hear you.
Sudeep, I can't hear you.
You can go with the slideshow.
Technology. Okay, now I think now I can hear all of you. Right.
Yeah, you can continue with the slideshow.
Yes. So I think that
Doctor, you can continue with the slide.
Yeah, that was the last slide anyway. I just wanted to show that.
Doctor, you can continue with the slideshow.
Yeah.
No, that was the last one, I believe so.
That was the last one. So you can hear me now?
Yes.
Okay, right. That was my last thing. I just wanted to share that.
Yes, we can hear you.
Yeah, I can't hear you. Can you hear me?
You can go with the slideshow.
I'll finish the slideshow. Okay, now I think now I can hear all of you. Right.
Yeah, you can continue with the slideshow.
Yes. So I think that
Doctor, you can continue with the slide.
Yeah, that was the last slide anyway. I just wanted to show that.
Doctor, you can continue with the slideshow.
Yeah.
No, that was the last one, I believe so.
That was the last one. So you can hear me now? Okay, right. That was my last thing. I just wanted to share that.
Yes, we can hear you.
Yeah.
Yes, sir.
I think.
Ma'am, I think there is a background noise.
Yeah. I'll finish this.
So are we clean now? Check.
It's okay, but there was some glitch somewhere else.
I think it was the YouTube which was.
I think it was kind of getting repeated, yeah, from YouTube.
Yeah.
That was, I think, yeah.
I feel that Dr. Shalini had it on her machine, and then we were playing on Zoom also, so it was twice.
If we re-log in, I think it should be okay.
Yeah, re-login should be. Shalini, maybe you might want to log in again.
I'll just tell her on the WhatsApp. I think it was the YouTube which was.
I think it was kind of getting repeated, yeah, from
Yes,
YouTube.
yes.
That was, I think, yeah.
No, that was the
I
YouTube.
feel that Dr. Shalini had it on her machine, and then we were playing on Zoom also, so it was
There's a
twice.
clash of
If we
technology.
re-log in, I think it should be okay.
Yeah, re-login should be.
So, do you want me to?
Yeah, Doctor,
Shalini, maybe you might want to log in again.
Right, I'll do that.
I think now it's fine. We can hear her.
No, let us re-log in. We still have the problem.
Sure.
Yes,
No, that was the
Leave it. There's a problem. Good.
Yeah. So what was happening? What I said 2 minutes back was being played again.
Yeah.
So there is some problem.
No, that
I
is the
think there was some glitch with the Zoom itself where the recording is also happening, and after a while recording is being played again and again. So it's a lag somewhere.
Recording
I
other.
think that was the YouTube.
But recording cannot. The meeting is so that is not the problem.
Or maybe the YouTube live is still running and that's being repeated in a lag.
I think there was a lag there. That's why we could hear. I think there was a lag of some 15-20 seconds.
Correct. From the YouTube, it seems.
Correct. That's right. From YouTube.
right. I think are we all back on again?
Yeah, we are back.
Yeah.
I'm so sorry about that.
No. It was not your issue. I think it's the YouTube which was creating the problem.
Great.
So, yes, doctor. So you had the presentation on. It's the last slide is through.
Yeah, that was the last slide, and I just wanted to show that video, the promotional video by all the stars and the cricket players and Mysore Queen, all of them appealing for the plasma. So I'll do one thing. I'll just send the link, and you can actually circulate in your groups as well.
Yeah.
Which will be a nice thing to do. Right. So coming back to my club, the plasma campaign, I think there are a lot of questions, especially every single day, the new reports are coming up. One says like the kind of quite of some of them are confusing as well. So let me tell you, this time the pandemic or the second wave has been the most disastrous thing I've ever seen in my life. So like if you look at the swine flu, when the swine flu hit, like I was in the UK and we knew how to deal with it, and people used to be on the ventilators a certain number of days, and if they don't get out of the ventilator, we used to put them on the bypass that is called ECMO, and we always knew the kind of the outcome was quite good. But this time, like and the first wave as well, as a flying team or the air ambulance, we used to go out and we were able to rescue people in the sense like we used to intubate them, put them on the ventilator, bring them to a higher center. We hardly had any kind of deaths. This time it is so bad that like at least the minute we land, we have seen people crashing even before we reach the airport. We have seen people dying literally. We entered the hospital, we were painting them to put on the ECMO, they crash and die for no reason. Like, you know, very young, healthy people who were well like 2 weeks ago are just giving away in terms of the most complicated, or I would say most destructive thing in terms of a virus other than a human who has always been a destructive element of the society or a nature. This time this virus has taken over that, which is kind of a beating the life out of us, beating the energy out of us, beating the spirit out of us. There is not no certainty at all. Like, you know, every single day I wake up and think like, is it me tomorrow? Is it one of our family members? Is it one of our team from the air ambulance team? It is so like, you know, scary, because we see the worst as well. As a air ambulance team which is flying out to the most remotest corners of India and rescuing people and putting them on ECMO, because if somebody has reached the ECMO, that is lung bypass, that means they have reached the last stage of their survival. That is a last chance. So we see the worst case, probably the sickest person in India at that point of time. So what I would like to say is like, of course, under Mission Cope, we would require all help in donation. And plasma is all about timing. There's no point giving plasma too early, like, just somebody has or asymptomatic, a mild fever or body ache and things like that. It's of no use if they have crossed the kind of oxygen requiring phase, or the early phase, or they've gone into the second stage. It's absolutely of no use.
Doctor, can I interrupt you for a moment?
Yeah.
Okay, sorry to interrupt you. Like, I would like to request if you can step back for a moment. Like, and if you can, like, because you can think it's a one-on-one kind of a thing for most of us here. If you can just step back to the fact that explain us a little bit about plasma therapy. Like, so how has evolved, like, and how has a methodology of treatment amongst the others, like, so we hear about the REMS fires of the world and a couple of other treatments, how this comes in to the picture, like, so if you can just tell us the evolution of this, like, then that will help.
So this convalescent plasma is nothing new. It has been a treatment, a proven treatment as well. When the Ebola breakout happened, they used to take out. It's all about common sense. Convalescent plasma is nothing but common sense. So there is, until today, there is no proven treatment for coronavirus or the COVID-19. So every single thing has been trial and error. The entire intensive care medicine is about trial and error, which suits which person. But at least for some of the antibiotics, like streptococcus, staphylococcus, there are salmonella, like typhoid, malaria, we have proven and established treatment. For this, A, it is a very new disease, and B, it is a virus, and it mutates very fast as well. So there are no proven treatment for this. We can talk about a lot of things, the remdesivir or Fabipure tablets or anything you talk about. Because there is no one established treatment, it's all about trial and error again. So there's a combination of treatment which nobody knows which works is the best. So convalescent plasma, if you look at it, if somebody has had this disease, it's like giving, like, after giving a vaccine, somebody's produces antibody that protects them. It's the same thing. If I had a COVID disease, I will recover from it, and I would have produced antibody, because that's how I would have recovered. And same thing will be taken out from the plasma, which contains a good antibody level after doing the antibody testing, and then that is transfused in the people who are suffering. So it is as simple as that. It is nothing complicated or rocket science when it comes to convalescent plasma. So again, coming back to your question, Mr. Sudeep, there is absolutely no 100% evidence for any treatment for corona. It's all about combination of therapy. May it be remdesivir, may it be to certain extent steroid has some good evidence. And again, not in the early stages. In the second stage is steroid when it is given, not when the virus is multiplying. And the third thing is, of course, this plasma therapy.
Okay. So, I mean, how does it work, and when is the right time to apply this plasma therapy? So that's one question we come across.
The right time, I would have seen from my own experience, and also, like, when we started in Karnataka, when we were bringing all the intensivists and the physicians on board and telling them, like, okay, let's start using, and getting the feedback straight from the horse's mouth, was it is most effective when it is given when the patients go on oxygen therapy, like, between 4 to 6 liters or 8 liters. When they reach that level, that's when we give plasma, and we've seen very good recovery rate within 48 hours, people turning around and getting better, and even some of them even going home. So again, like, there is, whenever we see these studies and things like that, the recruitment for the studies have been not very diligent. Like, they just take everybody who receive plasma, everybody put into the same group and see what is the outcome. So there will be someone who never required plasma, someone who the plasma won't make any difference to them. It is as simple as that. Because if you look at the COVID disease, it affects or it destroys the disease in three ways. One is, like, infection by itself. The second one is causing clots, thrombosis, that's called. The third one is scarring the lung, that is fibrosis. So because it is so destructive that it just goes in and it scars the lung. Like, for example, we have a cut, it heals by itself, but it is leaving a very bad scar in the lung. And lung is like a sponge, and if it becomes scarred, it becomes fibrous. When it becomes fibrous, it doesn't work in oxygen exchange therapy. Like, it doesn't do the oxygen exchange. So when there is no gas exchange happening, when there is the lung becomes a waste organ or a solid body. When it is solid, it doesn't work. It's as simple as that. So to prevent These three people gave for thrombosis. There is anticoagulation to keep the blood thin. The other one is to prevent the scarring. It's a fibrosis. It's a steroids what we give. Other one is the remdesivir, and plasma is all for like an antibody or to get the fight the infection. For the infection, it is so. This is where the plasma comes into picture.
Okay, thanks, doctor. So when would this therapy not work? Like, when is it too late to go into this?
Yeah, I think anybody breaching, when they like this is classified easily into mild, moderate, and severe. So if you look at the mild, is like which people get headache, myalgia, like body ache. Myalgia is body ache. Sorry, I'll be using some jargons, or mild fever, sore throat, things like that. The common symptoms. When they're at the same state, it does not. Of course, it's not absolutely of no use at all, because without anything, they would just kind of most of them recover. At least 90% of them recover without that. And there is when moderate, when they start requiring oxygen. That's when it kind of has been effective so far. And when it becomes severe, that means lung damage has happened, the fibrosis has set in, cytokine storm has happened. So, and the severity is so much that it's not going to, plasma is not going to be effective at all that time. So, in fact, there are some studies which are saying that plasma is not even a good idea. It might even be like, effect in the bad way in terms of viruses getting used to it and mutants, getting the more mutants and things like that. So the timing of the plasma is the most important thing. That's when the moderate phase, when they started requiring oxygen.
Okay. So is there a downside at all, like, as a bad side effect equivalent kind of a thing when you use this?
Until today, there was every single day there's a new evidence comes out of about everything. Like, some people say today steroids has been effective to a certain extent. Of course, it affects you in lung fibrosis, but people use it not judiciously used and overuse the steroids. Then we started seeing these black fungal infections, mucormycosis, which has become the scariest part of the people who are, because there's no treatment for that, and the surgical debridement or surgery is the only treatment for that as well. So again, when we use it, when you not use it, is the thing which is the most important thing. Again, if it is misused, until today there was nothing to say plasma can adversely affect, although it may be useless when given in the severe form. And there's only very small in which given, we have seen in trauma patients when we used to give lot of fresh frozen plasma and lot of blood products, platelets, RBCs. When we used to have massive transfusion, we used to see something called transfusion associated lung injuries called TRALI. That again we used to see in the intensive care unit, who require like 35-50 units of blood we used to transfuse. Especially like for example, there was this guy, like I worked in Belfast, where we used to have a lot of bomb blasts, and this policeman, bomb was fitted in the bottom of his car. It went off, his lower body was blasted off. That time in theater we gave him more than 100 units of blood. So that then, like, they had risk of developing a TRALI because so much of blood product went in, and there'll be some kind of a reaction. But if you otherwise, giving 1 unit of plasma, I've never seen anybody having a transfusion associated lung injuries. Even though with 1 unit also there are evidences people having, but in this we haven't seen in the COVID scenario, because already lung is
any side effects.
This is exactly I was talking about, the side effect. So that was the only side effect, which is very, very, very minute, very minute in the sense that it's negligible.
Okay, thanks, doctor. So, from your clinical observation as well as the studies which are coming in, what percentage of patients can actually get better with the help of plasma? I mean, just to get a
again, there is no strong evidence of the picture perfect studies so far, which is saying, okay, these people have been kind of, this is the percentage of people who improved on it. But if you look at one of the New England Journal medical publication which recently published, they say in elderly population it has been kind of a successful in 2/3 of the people where they got the plasma. Again, all the studies have downsides. Groups are small because such a new virus and the disease. It's very hard to provide any substantial evidence to say. As I was saying, these studies are also when they're recruiting people, they're not recruiting the ones where the mild ones, the moderate ones, the severe ones. Everybody gets recruited, and there's kind of some kind of skewed studies as well. So absolutely nothing to clear cut to say, okay, this is a study this many people recovered, this many people didn't recover. Because when we are treating these kind of severe patients, a lot of contributing factors, because they would have had other diseases along with that called comorbidities, or other complications as well, like as I said, thrombosis, there is fibrosis. COVID is not just an infection and it's not going away, it is causing other destruction as well. Some people, it's also affecting the heart, it is affecting the stroke, they're getting strokes, they're getting clots in the lungs, clots in the legs. Then some people end up having myocarditis, that is infection of the heart itself, like pure heart, and they suddenly end up with a cardiac arrest. So because there are multiple things which can it affects multiple organs of the body, it is very hard to say that, like, with these people got this and clear cut picture. But if I'm seeing clinicians across the world who had personal experience and coming up with saying, like, okay, I gave it in severe, it didn't work, I gave it in mild, it's not of use, when I'm giving it this stage, I'm getting a good result. So if we take like some 10 intensivists across Bangalore or Karnataka who have used plasma, they'll come up with saying, like, yeah, this is my personal experience. If you take at least 60 or 70 to 80 of them have said like, yes, we had a good outcome when we gave it at the right time.
Thanks, doctor. In fact, that was the reason I asked that was it was more a preamble to the next question on, like, this donation drive, which you are talking about, the plasma donation. So we have a lot of members in today's group, like, who are volunteers on the plasma drive. I think they would be coming with a lot of questions. So it is to just get a sense, like, so how large is the need? Like, how large should we, the volunteers spread out, like, so how much we need to do these kind of things. Like, I think you can talk a little about that. And of course, the people in the group, like, who have been fairly experienced on that, like, we'll have a lot of Q&A. But before you start on that, like, there is a just recap of what you just mentioned. Like, I think we have Deepti Rao asking this. Plasma can be either extremely effective or completely ineffective for different patients as treatment. Is this what we should infer, is what she is asking?
I think if you look at when we said, when we face a disaster or a pandemic or an unknown enemy, I would say, where we don't have a right answer, anything that makes even a 5 to 10% of a difference is important. Because there is no definitive therapy, as I was talking to you earlier about. There's absolutely nothing to say remdesivir is a magic bullet, or Favipure tablet is a magic bullet, or a steroid is a magic bullet. Since we do not have anything, a very specific definitive therapy in this disease, and if I say, like, plasma can improve the outcome in this category of people, I think we should just go for it. Because as I was saying, the entire treatment for COVID-19 so far has been a combination of therapies. It's not one particular therapy. And if plasma is contributing even by 10 to 20% or 50% or 40% better outcome in particular category of people, I think that is the right thing to do.
Okay. Thanks, doctor. So yeah, now you can give a little bit background on the donation drive itself. Like, so what is the need, which was that earlier question which I asked, and
so the need, there is a huge gap between demand and supply. If, for example, like, just day before yesterday, there was a twin pregnant girl in Chikbalapur, and I was on a call with my COVID India, the volunteers COVID India campaign, and I was on the call when I got, normally before every day we used to have at least like 5 Zoom calls of different initiatives, and I used to be attending all of them. But now my time is like, my clinical work is so overwhelming, I kind of try to attend one a week. And among that one, coincidentally, when I was on the call, I got, for this twin pregnant lady, we need urgent plasma. So it was literally organized within 10 minutes, and the relatives came and collected and gave. After that, from Chikbalapur, I'm getting every single day from the same hospital at least 20 people calling for the plasma. If it is one hospital demanding so much, you can imagine that how many hospitals are there across Karnataka, across India, or across even Bangalore, who's asking for plasma. Because it is a situation which is desperate, and people are reaching out thinking, like, their relatives or the families do not want to be left thinking like, okay, we didn't do enough. And even when the doctors think, okay, I've given this, but still there is no improvement, shall we try that one as well as another resort? So it might be helping it may not be helping, but at the same time, because it is combination of things that is helping out, they say let's give everything and see which helps out, because nobody knows which is helping you out. Due to that, and everybody wants to get a hold of the disease, or stop or the seize the stage 1 going to stage 2, or stage 2 going to stage 3. Because we are looking at the people who go on ventilators, the outcome is so poor. Like, once they go on ventilator, even in the world best countries like, Italy, for example, or America, the people coming out of the ventilator were only 20%. If you look at UK is one of the who have the best evidence-based practice, and they had the outcome was like only 50%. Only one person going in a ventilator were coming out of ventilator, coming alive. And so if those best practice countries can have such poor outcomes, you can see in India where the standardization of care is very bad. So like, even for example, All India Institute of Medical Sciences of Delhi is not the same as All India Institute of Medical Sciences of Rishikesh or Patna. So they all have their non kind of, they're not, practice is not totally standardized, the training is different, the doctors are different, the practices are different. If you go into national health system in the UK, if you go into district hospital or you go into tertiary care center, I know exactly if I walk into that, where exactly I can find a ventilator, where I can find a crash room, where I can find adrenaline, or if I want a syringe pump, I know exactly where it is because it's so standardized. But India, you know yourself, like we have smaller nursing homes, we have private hospitals, we have government hospitals, we have tertiary care centers, we have corporate hospitals. So when the standardization is so kind of significantly varying, the demand also is like kind of we don't know who wants where, who's using it for what purpose, where it is taken up. But at the same time, everybody is reaching out to do the best for the patients. Everybody wants to save their patients. Everybody wants to make sure the patients do not go from stage 1 to stage 2. So as I come back to your question, that's where we stand, and that's where the demand is like, yes. Okay. So just one call. I'm going to take a call again.
Yeah, sure.
Hello? Sorry, we were just landing in Mysore to pick up a patient from there who's pretty sick. So just they got a call from there, like saying that your pilot has lost weight, is not landed in Mysore. I'm just joking. Like that was a call. Like anyway, so the demand is very high, and if we have 10 when like 100 requests, probably we are able to give 10 is all what is being able to satisfied or kind of supplied.
Doctor, we'll just open to Q&A. Like, I have a question here, like, which says like, how many patients can use 1 unit of plasma or a plasma from one single donor?
Okay, so normally the one donor is can give 2 units, and one patient normally is transfused 1, and second dose is given after 24 hours. Only like depending on whether they require it or not. Some people just with one dose they're like more than happy, and they do not require the second dose. Sometimes they get repeated. One donor can donate multiple times. So once they recover, if I have a COVID and I get a RT-PCR today, after 28 days I become eligible to donate. And I do not require a COVID negative certificate for that. The one positive report and 28 days from there is enough for me to become eligible to donate. After that, every 2 to 3 weeks can donate up to 3 months, up to because the antibody level do not stay constant throughout the life. It starts waning down, or it starts disappearing after 3 months. So now the levels start going down. Some people are very lucky to have maintained a very good antibody level up to 6 months. And if it is like, up to 6 months, they can keep donating as long as antibodies levels are good. Anyway, the blood plasma banks first check the antibody level, only then they go ahead and take the donors who are fit for eligible or for plasmapheresis.
Okay, thanks. So there is a question by Abadi. Can you please explain the process of plasma donation? I think you covered that. Anything specific that you need to add apart from what you just mentioned?
So far, like, women who have had babies or children are not eligible. The reason being, we need to do a specific test for that, because it is pretty complicated, and the test itself is not available in all the cities in India. And then it is kind of in UK there is no restriction, because they carry out that test for the women who have had children, and the test itself costs some 11,000 rupees. And it's not available across in India. Just to avoid the complications or confusion, just said nulliparous women. That means women who have not had children are eligible. And people up to, age is a number to me, according to me. So up to 60 is definitely allowed. And diabetes, hypertension, if they're suffering from, is not a contraindication at all. They can definitely be donors. People suffering from blood diseases, like, they cannot donate. People who have had like HIV or hepatitis infections can't donate. But having said that, they screen them. When donors go into the plasmapheresis or a plasma bank, they screen them, and then they take the plasma from them. And they also do certain infection tests as well.
So there is a question which says, like, there was a donation bank approaching the Resident Welfare Association, asking to donate blood and stating they will extract the plasma there itself. Is there a process, or is there a viable way to donate plasma? Do we need to go to the plasma donation bank? What is the
Yeah. So when you go to we have to be, this plasmapheresis has to be done in the controlled environment. It has to be done in the hospital environment. There should be a license that it is strictly controlled by the drug controller of the state or the country, whatever it is. So it can't be done in a out of hospital environment at all. There needs to be a hematologist on site. They need to have a crash trolley. All the backup plan if somebody kind of has any kind of setback. So it just can't be done anywhere outside the hospital environment.
Thanks, doctor. So what are the after effects of plasma donation? Are there any?
So if somebody wants to donate plasma, it's as simple as, like, replacing a couple of glasses of water. So all they have to do is to be well hydrated before going, have had their breakfast or lunch, whatever the time they're going, and would have, like, drank enough water. And even after that, they can have a couple of glasses of water. That's all it needs, because what is taken out is not the red blood cells. So at least even when you're donating the blood, the hemoglobin drops. Or the hemoglobin, red blood cells are taken out. People feel dizzy and things like that. So in here, the red blood cells are given back. So the hemoglobin doesn't even get affected. What is coming out is just the kind of a white form of the blood, which can be easily replaced with a couple of glasses of water. And in fact, there are some certain people, some of the hematologists saying the cholesterol level drops as well donating plasma, because kind of all the fats, some of the fat cells can also go away when they donate plasma. But anyway, that's all kind of don't want to quote them or make it a point here. So it is just off the kind of a conversation which kind of just mentioned.
So there is a question here. Is there any cutoff of antibodies for the donor?
Yeah. So there is kind of broadly I'm classifying, because we're not addressing the hematologist or the medical group here. Just for understanding, there is kind of a mild level, moderate, and the very good levels. So above moderate, we can take it. And then again, at every hematology lab or the plasma bank have their cutoffs for that. And the very desperate situations where we have had, like, not a very good levels. And then we have given the same patient 2 units from the same people. Same, like, normally I said one person donate 2 units, and two patients can benefit from 1 donor. So at that time, what we do is, like, if we are extremely desperate, somebody needs it very badly, and that blood group is not matching, so one person's 2 units will be transfused to the one patient, like one patient himself.
Okay. Ashima has this question: why are doctors asking specific recovery time of 2 to 3 months for few patients recently? And also another follow-up question: few people have suggested that plasma can be donated up to 8 months dependent on antibodies level.
Yes, absolutely. As I answered that question already, if the antibody levels, some people are extremely lucky for having the antibody levels stays for a longer time. But from the studies, what we have seen, after 3 months, it starts slowing down or it starts dropping. And if the antibody level stays good for 8 months or 6 months or whatever, you can be a donor. at a span of 2 to 3 weeks you can donate.
So that I couldn't gather if that the specific recovery time of 2 to 3 months.
What exactly is that question? 2 to 3 months.
I didn't get it. Ashima, you want to just post that question? Ashima, you want to come online and ask it?
Hi, Dr. Shalini. So we keep getting messages where doctors have specified just recovery time between say 15 days to 2 months or 3 months, but this is happening from recent requirements in the second wave. So are there any changes? Why do they ask for a very specific time of donors?
So the best way to answer this question is there's nothing called a recovery time. If somebody has produced antibody in their blood, that means they've recovered, because only when you recover, the antibodies come into you. The body produces antibody as a sign of recovery. This is the reason why we check the antibody level before we take we take plasma from the donors. So if we come, for example, if I've recovered from COVID and I go to donate, my antibody level might be 0 even if I've crossed 14 days. Some people are so unfortunate they never have any antibodies at all, even after 3 weeks, 4 weeks, 8 weeks. But most of the people have a good antibody level after 28 days. The first sign of recovery is positive antibody itself. That means if somebody is testing positive for antibody, that means they can be a donor. It's as simple as that. So that's the reason why the antibody level is checked before we take the plasma from anyone.
I think Deepthi has a question which partly you answered, but I just posed the first part. Can plasma be extracted from a blood donation?
No, in the sense if you look at fresh frozen plasma, when blood donation camps happen, we can take the blood and then we can separate them in the blood bank, store it as a fresh frozen plasma. All that could be done. But in the convalescence plasma donation, there's been strict guidelines that in the blood donation camps, we can't do it because we need a plasmapheresis machine. And that machine is pretty, it's, first of all, although it is mobile, because the newer machines, especially the one which we donated to plasma bank in Mysore Care Hospital, quite a mobile, it is as big as a microwave, which we can take and do it. But we need a specialist technicians to do it. We need hematologists to be on site. And again, as I said, we need to have a backup if there is any clinical setback. So this is the reason why we can't do it in a blood donation camps.
I'll just pose a follow-up question. Perhaps this answer took it, but still, is that still useful if the antibody level is high enough, and is that equal to 1 unit of plasma?
So if they have the only way anybody will be donor is if they have a decent level of antibody, and one person can donate 2 units, and both the 2 units will be given to 2 different people. So I think is this what exactly you're trying to ask me? I'm slightly confused on the question.
Is that Deepthi, you want to just come in and...
Sure. Thank you, Doctor. Thanks for all the information you have shared so far. Appreciate it. My question was essentially in 2 parts. The first was, which you've already answered, can blood banks through blood donation drives get the requisite amount of convalescent plasma? And you've said no, with the caveat, of course, that it is better for good plasma, if you can call it that, to be given directly through plasmapheresis at a blood bank. That is understood. But my follow-up question, which I think might have been a little confusing, was if plasma was to be extracted from blood, how much would you get? Would that be equal to 1 unit of plasma donated directly? That was my question.
Normally, it's 2 units that is taken off from one person. So each bag is around 200 mil. So 400 mil, 400 to 450 mil is what the plasma that is taken off per donation. And that is you replace it with half a glass of water, half a bottle of water. That's half a bottle of water.
So is it comparable, the amount of plasma that you get from extracting it from blood through a blood donation drive and directly donating plasma? Is it roughly the same amount that is extracted?
Yeah, it's almost the same. In blood donation, the RBCs, the red blood cell, is given back. So the hemoglobin, in the blood donation, the whole blood is taken out, right? Which includes the platelets, which includes plasma, which includes the red blood cells. The three elements to a whole blood, So in a normal blood donation camp, when people bleed out, they take the whole blood out. Here in these plasma donations, it's only the plasma that is taken out. Everything else is given back into the body.
Thank you. So then it's still plasma only that is more effective rather than plasma being extracted from whole blood. Sorry, go ahead. Please take your call. I can stop asking.
Sorry.
No.
In a plasma donation, it's only purely plasma is taken, nothing else is taken.
Right. So I just wanted to understand if it is just as effective to only give plasma at a donation bank. Is it the same effectiveness as getting plasma from donated blood drives? Is it the same thing?
When we are doing a blood donation camp, we don't check for the antibody level. Then the criteria will not be the same. They don't have to be COVID recovered for 28 days. So this is a much more specific extraction of a plasma for a specific reason. So the two different things here. So what I know, I'm understanding what you're saying. Why don't we just go on doing a blood donation camp, and why don't we just take the whole blood and test them and give the blood? But there is a lot of different criteria for even the cross matching, or the whose blood could be given to whom, or which plasma given to whom. So it's kind of a slightly different criteria. So I think like blood donation camp can't become the plasma donation camp, and there are two different way of doing it as well. When you look at a blood donation camp, you just go and sleep. Somebody puts a needle in, the blood is extracted out, and that is taken and stored and gone into the blood banks. They test everything, and they kind of say, okay, and this also has a very short shelf life as well. But when we are doing a fresh plasma donation camp, there is like, for example, who can get it is also in a little different than the blood, pure blood. What we require is a pure plasma here, which is full of antibodies. We don't require a full blood. And the full blood is not only a waste, which should be given to patients who require blood than just require plasma. So here, and again, if I want to donate, I don't want to donate the entire thing. I just want to donate my plasma, because which has got antibodies. Why should I give all my blood? It's not even a requirement. Again, if I take blood, again we have to test everything, and it's like a lot of waste in terms of infrastructure. The campaign is not very directed, and it just dilutes the entire effort. So we have to keep it very separate and in a very defined manner. And in terms of like treating this COVID, we need only convalescence plasma, and the blood is for the other category of people who have lost blood, trauma, pregnancy, massive bleeding, and things like that.
Thank you.
Doctor, I think I have questions to hold you for another 15 minutes. Is that okay?
Okay.
I'll go on. I think we have this question from Sai, which says, is there a restriction like a person? It should be the same blood group which should be administered?
So it has to be matched. So, but there is a small different criteria. If you want me to go through that, I'll go. Otherwise, what I'll do is I'll share that slide with Mrs. Sudeep, and then he can share it with all of you. Because when I'm saying, I don't want people to get it wrong or get it confused, because end of the day, it's not like, making any difference for the donors. It's all making difference for the clinicians who are transfusing it or prescribing it. So I'll just share that slide, because it's a very scientific question. I would want to share that information than saying it out, because I don't want people to get it wrong.
Sure, doctor. Thanks. I'll share.
But it is definitely group specific. It is definitely matched.
Okay. Okay. We have a question here. Is plasma therapy safe for infants and children? And then it goes on, or giving IVIG is safe for infants.
Right.
You want to ask that question?
Yeah, I'm ready.
Yeah, Srinivas, okay.
Yeah. Hello. Good evening.
Good evening.
Hello. Yeah, I'm Dr. Srinivas here.
Yes.
I was just going through your presentation. It was a very excellent information. You have given everything, this plasma therapy. My question was whether it's safe for infants, children's plasma therapy, or we can try with this IVIG concept which we were using for this inflammatory disease, autoimmune disease. That was just out of my curiosity. I am asking,
Yeah.
So this may not be relevant in this platform, but still, for my information, I wanted because I have seen some literature. They use this IVIG for severe COVID cases in infants. So why you cannot substitute IVIG instead of plasma for infants?
This is a very unique and a rare question, but very interesting as well. The reason being is we do not have any kind of a paper supporting convalescent plasma transfused in children or infant, because there have not been many cases who require it so far.
Correct.
So since that has been, I don't think so. Even the children have been so severe enough to require plasma. I mean, very small percentage of
very small percentage. Yeah, Kawasaki disease. Yeah.
Exactly, Kawasaki disease and things like that, which is more like a immune response and things like that. Then plasma is given more antibodies for the infection than for the immune response.
Correct.
So the immune response is more like immunosuppressants. But here it is plasma is more like an antibiotic or antiviral because it's antibodies in it. That's what we are trying to do. We're not suppressing the immunity; we're fighting the infection. So they're two different things. In children, it is more like immune reactions than the infection per se. So it depends on what we're addressing. We do not know. We do not know tomorrow because they're saying there are a lot of talk going on about the third wave affecting.
Third wave, which is affecting the children's infant.
I think when it comes, probably then again, no other countries also have had very good experience with it. And I haven't seen any papers coming out on. I mean, as I mentioned, on elderly, it has been tried with kind of a result. Although some number was small, which I can share the paper. But on small children and infants, I haven't seen. But if you look at it as a common sense, except for the fluid overload and things like that, which comes with any other blood transfusion, I don't see any harm in giving it as well. So as long as it is matched properly and things, for example, it has been given in pregnant women, and if they can give it, fetus can get it absorbed, then children and neonates or the infant should be okay.
Okay. So that is just thinking in view of third wave. They are predicting more it will affect the children's and infant. So I was just out of my curiosity. I asked whether it is safe. I know the severity in children's and infant are very less. So hardly few cases we have seen. I think one or two in Mumbai, if I'm not mistaken.
I think there's only one Kawasaki disease.
Kawasaki one, which is the more concerning, worried about this Kawasaki only, cardiac.
Children recover very well, even from Kawasaki.
Yes. Even my small child, he had a fever of 4 days. It was more of COVID, but he recovered very fast. Yeah,
very hard to differentiate between viral gastroenteritis, viral fevers, and COVID. And
correct. Children's is something very difficult. It can be anything. Because there will be more of this because there will be recurrent viral infections in the children's, very common.
And then some of the kids are presenting with vomiting and diarrhea. We don't even know whether it's coexisting viral gastroenteritis or it's a
COVID related,
which is manifesting.
Correct. But as such, the prognosis in children, the infants are quite.
The biggest challenge children having COVID is isolating them.
Isolate. That's the thing. But as such, there is no, even for adult, there is no as such pakka concrete treatment.
Yeah.
Even the pediatrician also, nowadays they give the normal adult type of the dosage varies. Yes. Thanks for your answer.
Thanks, Dr. I think that kind of puts a bird's eye view on what perhaps can come through when we have the third wave, if at all.
That's the thing. My concern was
Yeah. And I would like to acknowledge here, Dr. Shalini, what Srinivas has been doing. And for many people who don't know, Dr. Srinivas has been volunteering endless number of hours, in our volunteer groups, helping a lot of patients, right from their, the problem they are having to the end of going to the end of counseling and checking up what happened. Thanks, Dr. Srinivas.
I can understand he's being proactive about dealing the third wave already. So that just shows his commitment and then the proactive.
Yeah. Even the first wave, because we were trained in CMC Vellore last year. Yeah. Okay. Thanks for your
pleasure meeting you.
Kapilji has wanted somebody was donated who is amongst us. Perhaps after this Q&A session, we'll bring in Kapilji. And Chandrani had a question, I think it's a question which doctor asked, if you're okay, Chandrani, I'll move to the next question.
Sure, done. Thank you.
So I think you are clarified, right, on that particular thing?
Yes, absolutely. Thank you.
We have a Dr. Philip Singh who asks, what is the value or rating of the antibodies to give plasma?
Is it okay if I kind of text you that again? Because a lot of people think, okay, mine is 50, mine is 100, 120, 100. Because a lot of people are going to the labs and also getting it off the prescription, getting it tested. And there is kind of a confusion among the lot, because every single time the donor has been selected at the discretion of the hematologist on site as well. So that is one clinically oriented questions which kind of confuse a lot of people. I'll DM or personally text you if you can share that number.
I think Dr. Singh, between Abadidi and me, we'll ensure that message reaches you.
Yeah.
So that's fine, Dr. Singh?
Yes, thank you so much.
Okay, we have Pinkisha asking for plasma donation. Do antibody tests have to be done immediately before donation, or when should it be done?
It should be done immediately before the donation. In fact, it happens the minute you go in as a volunteer, as a donor, the first thing they do is test your blood for certain infection screen like HIV and HPSAG. And I can share the FAQs as well, for which can help you all to understand more. And then the second thing is they will immediately check it, and then only within 1 hour you'll be donating it. Yeah.
So, Dr. Shalini, when I was speaking to you, you had mentioned that when we are doing a donation drive at a certain place, then we can do the antibody screening at the apartment complex or wherever, and so immediately within.
That was a kind of a different way of putting it. So antibody level does not drop overnight. So if for the donors who go into the blood bank, I was coming from the plasma bank, I was coming from that angle. So when you go there, they immediately test you and take the donation or take the plasma. But of course, we can do it 6 to 12 hours before, 24 hours before, because last time when we did the Karnataka Reserve Police camp, what we did was we had some 150 people, and in that some 60 qualified. So we put them into slot. So we couldn't, because every plasma donation takes about 2 hours. So we can't bleed all of them at once. So we had to slot them, and it took over 24 to 36 hours. We got all the donations. So no, there's nothing like immediately have to get the test done and give it. But if you go into a plasma with a allotted slot, they can take the antibody level, and immediately they can take the plasma as well.
So you mean to say that at the location wherever the donation camp is happening, you are basically shortlisting who might be eligible and who might not be.
So we don't might be eligible. We take all the blood samples, run the antibody levels on them, and then we inform, okay, yours good, and then we give them for 3-4 slots, and they can come in a slot that suits them.
Yeah, okay. So Karthik has a question. Can you please share your views on how can we be prepared for third wave? I think broadly, everybody would be keen on that. And also he wants a little bit on black fungus.
Okay. So coming to the first question, how can we prepare? I think the first wave we had, for example, if you look at last year, when the peak, Bangalore had at the peak, we used to have 4,000 cases, the maximum we reached. In the second wave, now today, there's 20,000 cases nearly. That I think this is the biggest slap on our face to say, don't become careless, or don't take it lying this, don't take it so easy. The only thing that can prevent the third wave is a second wave lesson from what we learned in the second wave. Because the first wave we got, then it all kind of because of the early lockdown, and there were not, and the other measures that were taken, very strict measures, and people were so scared in the first wave. I used to see ball rolling out of my house when the kids were playing, and the ball was sanitized coming, bringing it back. That was the degree of scare that people used to be about, and there was no outsiders coming into the apartment complexes. Everybody was screened, and they were when the 10 viruses were there, the precautions were million. Now there were million viruses. The precaution is almost nil. So when the reverse order is done, and that's why we hit the second wave, and that's why the viruses are also kind of taking sneaking into the houses where people have not even stepped outside, because it is I'm telling everyone, every single person you meet is COVID positive, and there is no way of you proving them they're COVID negative, because even the RT-PCR, the gold standard test, what we are calling it, is still only at least more than 22 to 30% is false negative in that. So you might have virus, but it could still be on the RT-PCR, still be negative. So there is absolutely no way of proving anybody is a COVID negative person. So, and even not even the vaccinated person, because even after vaccination you can get infected, only the severity of the disease is less, that's all. Somebody has to be extremely unlucky, or the mutant of that virus, it should be so bad or so extraordinary that they fall very sick, or they would have had, like, a lot of people, like, they would have taken the first dose of vaccine and they would have fallen sick and contracted COVID and gone into a very bad severe disease. Probably what would have happened is, like, they would have contacted during that period of, like, right before the vaccine, or until before the vaccine became effective. So, like, the complacency is the only thing which is, the third wave is going to come and hit us again, and making, the way we went ahead, opening all the shopping complexes, opening all the movie theaters, weddings. There were 10,000 people in the wedding in Palace Ground, like, just before, like, when was this, in December time or January time. So this is where this second wave came into picture. Otherwise, if we had been little careful, the way, if you look at UK today, they are like almost relaxing everything, but they were so strict until they had the lockdown, almost the lockdown, partial or full, almost for 8 months. This is the only way they kind of could avoid the severity of the following waves. Even the third wave, it comes or not, nobody knows. But if we become careless, and the only thing that is preventing, it's not the vaccine, it's not the remdesivir, it's not the plasma. The only answer for this pandemic is mass social distancing, and making sure that we do not have the crowded places, and being early to report if you have any symptoms. A lot of people ending up in severe disease are the ones who are coming late presentation, and people taking it for granted. Nothing's happened to me, I'm fine. Oh, I'm a fit and healthy guy, I have a good immunity, I'm a bodybuilder, I'm this, I'm young, I'm healthy. And there's also a little bit of a phobia and stigma as well. I'm seeing in smaller district, like, people say, even if somebody is having fever, they're so scared to get them tested, thinking them, ಎಲ್ಲರಿಗೂ ಗೊತ್ತಾಗ್ಬಿಟ್ರೆ ಮನೇಲಿ ಕೋವಿಡ್ ಇದೆ ಅಂತ, the people will start stigmatizing. That's another thing where that has to be, like, everybody can get this coronavirus, anybody can get this COVID-19 disease. It's not sparing the country head, it's not sparing the minister, it's not sparing the people in slum, it's not sparing anyone. So when there is no the virus is not discriminating, why are you discriminating yourself? Why are you getting stigmatized? Why are we stigmatizing people? Why are we shutting making people feel so kind of bad that they have the virus? Like, it might be family member, it could be your maid, it could be a driver. Just treat them like, okay, this is thing, you have got it, these are precautions you need to take, this way you need to be, this is how when you reach out to the doctor. That's all we need. Precautions, early reporting is the only way of beating the third wave.
Thanks, doctor. I have a couple of questions in YouTube. I'll just phrase it, but I think it's been answered. What's the right time to donate? How do we calculate the recovery time and all those things? I think the doctor has already answered that. And if the blood needs to be matched to that particular groups, I think the doctor answered that also. Can a normal person donate plasma, like, vaccinated non-COVID patient donate plasma? Doctor, a quick answer on that.
Yeah. So this question has been asked by a few of the hematologists as well, heading the plasma banks, like, why are we not doing that? But we do not have great evidence or great regulations on that to a vaccinated person can donate. But definitely, if somebody has been infected, the quality of the antibody they produce has been very good to treat the person who is having the disease. So this is the reason, because vaccination is mild infection you get, or mild response to the body producing antibody level to prevent infection. But somebody has an active infection, they produce a very good level of or a good quality of antibody. This is as simple as that. There are a lot of people who won't even know they've had COVID. And even the people who have recovered from COVID donating plasma, what we're seeing, the antibody level, are the ones who had like symptoms, proper symptoms. So for example, I get COVID today and I don't have any symptoms. I get positive because somebody in the family got it, somebody was a contact. And when I get tested for the antibody, my levels are not that great. But somebody had active kind of, they had fever, they had this, and you look at their antibody levels are much better. So see the higher kind of disease, the severity of the disease matching up to the antibody level as well. So there's a reason vaccine is not an effective way of producing very good quality antibodies. That's one of the reasons. But coincidentally, like if somebody had COVID and also taken vaccine, the game is better. Like, we can still take them, like take the antibodies from them or plasma.
I think that answers Kapilji's question of can plasma be donated after 2 vaccines? Right, doctor? Okay. Is there any age restriction on the plasma donation?
I mean, as I said, age is a number. End of the day, I think up to 60 people are, it's okay, fine. Some of the countries are going up to 65, 70. Some in India, they say, because probably our lifespan is lesser, they say below 60, things like that. I mean, 70 in UK is middle age. So if that's the middle age, then we can give it.
Why do we need 2 doses of vaccine and not only 1?
Right. This is a plasma talk. Anyway, doesn't matter. So if you look at any vaccine, even children are given, they give 1 dose and then they give a booster dose to cover for the entire year. The same with the vaccine, the first dose is given and the second dose is given so that you have a longer period of effect of that vaccine. So it's the second one is a booster dose actually. So that if I take a vaccine today, I might get, as I had mentioned earlier, I get infection, my antibody level lasts for 3 months, some people 6 months. But if you want to last this longer, you need to take a second dose so that the booster will cover you for a longer period. It's just to increase the lifespan of that vaccine, to give the booster to kind of you get covered or you get immune for longer period. That's it.
So this can essentially become an annual affair then?
Yeah, we can, of course, because flu vaccine in the UK is given every year. So, like for all the healthcare workers and the vulnerable, like severe asthmatic or elderly population after 65, like most of them get the vaccine every year. It's kind of some places, even National Health Service, they make it mandatory for the healthcare workers. Although, of course, it's a democratic country, UK, like India. It's not that you have to take it, but of course they say you need to take it.
Okay. I have perhaps the last question. Can a person who has contracted COVID contract it again?
Yes, as I said, if you're very lucky, the antibody can level last for 6 months, and if you're not lucky, you might not have any antibody, and you can still be vulnerable to get the COVID. So please don't take it easy when you get COVID. That okay, now I've got the good antibody levels and never COVID again. The repeat infections are. I'm seeing it from the doctor, especially in the doctors' community. I'm seeing they had COVID last time, and this wave they're getting COVID again. It all depends on how strong the antibody levels are in the body. Yeah.
Okay. I think black fungus, Arti, I think she already answered.
Black fungus, we are seeing black fungus, like even just literally 2 seconds before this call started, I had a call about, and I think actually I was still speaking. It said, can I take a call? And this was about a patient to be airlifted with a black fungus. It's called mucormycosis. It's a fungal infection. There are a lot of factors, contributing factors, is a combination of factors which is giving this black fungus. We are seeing it could be because we are using steroids in COVID-19, as I said, to prevent the lung fibrosis, which has got very good evidence to prevent lung fibrosis. It gets used after the second stage, or that somebody enters the second stage, the right time to start. And the steroid is immunosuppressant, and because when you give steroid, especially if somebody is a diabetic, the sugar levels go very high. With high sugar levels is a breeding ground for any infection, and the combination of immunosuppression with steroids and a very high level sugars and a bad hygiene as well sometimes, because sometimes a mask the patients are in the hospital, they would have used for so long, it might not be clean, and there is not even one single thing you can say because of steroids you're getting, or because of it's a diabetic or the other immunosuppressant, the body's immunity is low, or it is pure hygiene. I think it's just a combination of all three, where this opportunistic fungus, which normally used to be seen in people having HIV, where the severely immunosuppressed people used to get this kind of fungal infection, is coming up in this second season because of the immunity is so low that any kind of opportunities like tuberculosis, fungus, this can come. And mucormycosis, probably because it's so evident, it blackens the nose, and there is nothing to treat that, because antifungals, what we have, the best antifungals, the penetration to cure this is not enough. So the only way of getting rid of this is surgical debridement. They have to take that part of it and reconstruct, going for plastic surgery. It's a very, very traumatizing to see, to suffer, to treat, and they do not qualify for a lot of treatment as well. For some people, we have refused airlifting them because they do not qualify for lung transplant, and we do not put ECMO into someone when they can't go for a lung transplant as a bridging therapy as well. So even to look at it is quite traumatic to the relatives or to the family or to the patient themselves, and even for the people who are treating, it can be very stigmatizing.
So thanks, doctor. There is a question here which asks, there is a panel which is telling 1 dose of vaccine is enough.
It depends on which vaccine we're taking, but I think we should just stick to the gold standard than changing the versions million times. If I'm the vaccine maker, I will tell you how many times to take that vaccine, because I would have done all the trials. I would have known, because a lot of time, energy, brains, research goes into deciding one dose is enough and 2 doses. We require two doses. Sorry. So I think we should just go by what that vaccine, the particular Pfizer, Moderna, Covishield, Covaxin, whatever it is. If this manufacturer is saying you need to take 2, please take 2. If they say take 1, just take 1. It all comes from who has made it. There's no generalized rule like, oh, 1 is enough or 2 is not enough, or 2 is more or 1 is enough.
Thanks so much, doctor. I think that comes to the conclusion of all the questions out there. Thank you so much. Really appreciate your time. It was very informative, and I think you have answered a lot of our questions. As a set of volunteers, people, this kind of information is not only helpful, it is very critical for us. So we will probably dip into your knowledge resources in some other format every time we do this, because there is a whole which has been very active, plasma donation. I'm sure Mrs. Saxena will be in touch with you. So really appreciate your thanks everyone.
Thank you.
Yeah.
Thank you.
Thanks a lot.
Yeah. Thanks, Dr. Shalini. It was wonderful.
Thank
I
you.
was mesmerized the very first time when we spoke for 15 minutes, and I think you have so much of knowledge. Thank you very much. And as promised, we will start
speaking so much about virus, because until today nobody has ever heard from me. It's fine. It's just a virus. What is the end of the day? Until today, nobody has ever heard that from me. No matter who it is, I scare them to death, because that's the only way of preventing this
exactly
people from getting it. Because the carelessness is the biggest way. Is the biggest fact of people getting this, and once they get into that stage, we don't know how people are going to end up. Am I going to end up in ICU? Am I going to go home without anything? I'm going to walk away unscathed? Nobody knows. So this is the reason why I scare people so much. At least they become a little careful. Even if they become 10% careful after I speak about it, I think I feel my job's done, because I prevented that person from contracting it, at least from the carelessness. There are a lot of ways of contracting it. Nobody knows where it sneaks in. At least it's not because of your own carelessness.
Yeah.
Thank you, Abha. Thank you for giving us an opportunity to hear Dr. Shalini's wonderful section.
Thank you very much.
I can't thank you enough, Shalini. From your busy time, you took so much time to answer all our questions. Thanks a lot.
Thanks for having me. And the one small message I would like all of you to take home is, every single minute you're putting into this voluntary work is 1 hour of sleep for me or extra help work. You are letting us rest another extra 10 minutes, or sit back and have a cup of coffee at least. because that is that's 10% of the people or patients coming. And every minute you put into it, it really makes a big difference for healthcare workers. And thank you so much for joining hands in fighting this.
It's a pleasure, doctor. And
Thank you very much for enlightening us. Thanks.
Thank you.